Yeah, so let's dive right in. So, as I said, I am a program coordinator at the foundation, and it's been a pleasure of mine to be part of this project of ours that is now in its fourth year. I'm referring to our annual patient survey, the State of Steatotic Liver Care in America, which aims to understand, the lived experiences, the medical experiences of people living with steatotic liver disease in the US. And so I'm really excited to be sharing some of those findings that we've gathered over the last 4 years, and hear some feedback from you guys. We want this to be an open conversation, discussion, an open space to share your experiences. So we definitely encourage you guys to chime in, whether that's via the chat box, or I believe you can also like raise your hand to speak. So if you feel comfortable and you want to come on camera or just unmute yourself to share your story, if you feel called to do so, we definitely encourage that as well. We'll be looking out for those signals in on our end. So let's go on and hop in. So yeah, so as I already said, I've already introduced myself, and I'm joined by Dr. Mistry. He's our Chief Medical Officer, and we've had a really great chance to work on this project together. Neeraj, do you want to cover our disclosure and disclaimer statement?
Yeah, so with all our webinars and certainly for these community conversations as well, this is purely for informational and education purposes. We're not prescribing or recommending any treatments or therapies. These are best discussed with your primary care provider, your specialist, etc., and your care team. The point of this is to give you more information and hopefully that informs your conversations with your care providers and your care team and helps improve the way you manage your condition.
Thank you. So before I go into some of our findings, I just want to give a little bit of a background on the survey itself. So we initially launched the survey in 2022. Initially, the survey was limited to just those living with what was then called NAFLD and NASH. But with the name change in 2024, we decided to expand the survey to include anyone with steatotic liver disease. So this now includes people living with ALD, met ALD, and all of the other conditions that fall under that umbrella term. So the survey is, some could say, lengthy, about 49 questions covering 4 different areas of the experience. So everything from diagnosis and staging, of course, to better understand who is taking the survey, how that representation falls. We also look into medical management and physical impact, so how people are caring for their condition once they've been diagnosed, psychosocial and environmental impact. So once people leave the clinic, what does daily life look like living with these conditions? And similarly, current health, because we know symptoms do not stop once you get a diagnosis. We also aim to try to understand how people are feeling with their health currently.
Tiffany, I just want to add here, there was a
Yeah.
film back in the 90s, I think it was, with Mel Gibson, and it was What Women Want. And by some freak accident, Mel Gibson was able to read the minds of women. And I guess that's where we were coming from with this. It's like, what do patients want? How do we get into the minds and hearts of patients to understand really where they are? And I say this as a health provider, we often recommend these therapies and treatments and behavior change things, but we're not understanding how it lands. And that was the point of the survey. And I think the other important thing about this is that the patient community is not a homogenous group, right? So we have patients from different walks of life, different cultural backgrounds, ethnicities, etc. And so the patient journey and experience is also quite unique. And so understanding those nuances helps to improve the impact of our interventions. And so that was the broader impetus behind that. And this is how we organized it.
Absolutely. Thank you for providing that context. And I'll have to check out that movie. I'm not familiar with it. What was it called?
What Women Want. It was a
Hmm,
fun movie.
interesting. Let us know in the comments if you know that movie. Okay, so last thing, I just wanted to share with you all how the survey has grown over the years. So you can see we've consistently been able to increase the number of responses each year. And actually this year in 2025, we surpassed 1,000 responses. We're not stopping there because we know that is nowhere near the number of total people living with these conditions in the US. So the journey continues, but nonetheless, I'm at least encouraged by how we've been able to continue to expand and collect even more voices. And then another thing here, just to give you guys an understanding of who's been taking the survey over the years. And just, I guess, a forewarning for these graphs that you're going to see in the upcoming slides. The intention here is not to get into the specifics, looking at, specific percentage numbers. Really, the graphs are just meant to serve as a visual aid to understand, the summarized feelings of us as a community and use that, to help guide these conversations. So then just looking at who's been taking the survey in terms of age, people are in their late 50s, early 60s, and even this year, it looks like the average age was a little bit higher, around 67. Consistently year over year, the average respondent is usually a woman, though we do have representation from male and some non-binary individuals. In terms of race and ethnicity, yes, the survey is usually the respondents are overwhelmingly white or Caucasian, though we do have good representation from the Hispanic and Latino community. We do offer this survey in Spanish, and so I think that definitely helps increase accessibility, inclusivity of the survey, and it's definitely a goal of ours to continue to make outreach and make those connections in the other communities in the US because we definitely want to capture those voices.
Absolutely, Tiffany. And we also have the survey translated now in Chinese or Mandarin, as well as Vietnamese, right? Um,
Yes.
And so uh, I think notable is that the race and ethnicity distribution is not necessarily representative of the prevalence distribution in the general population, but more so how we've managed to leverage our contacts and networks to access those communities and distribute the survey. So the more our patient community can help us in getting to all these other race and ethnic groups, we can distribute the survey further. The other quick point I wanted to make is we know that women have stronger health-seeking behavior and health engagement than men. I have many friends, and sometimes I'm guilty of that as well. I won't attend my dentist appointments unless my wife makes the appointment for me and schedules that. So we need to sort of bring the male community more in, especially because the prevalence of muscle mash is higher among males than females. An interesting comparator with this was that the British Liver Trust, which runs a similar survey in the UK, has higher male representation or survey participants compared to women. So I think we need to sort of get that balance right as well.
Mm. Yeah, very interesting how cultural norms and expectations become quite visible in our research.
Mhm.
All right. And okay, so we're looking at diagnosis again, just to show you guys who is making up this survey. So the majority of responses each year have been either MASLD or MASH patients. We do have a smaller makeup of people living with ALD, and this is probably likely due to our close partnership with Jen of Sober Livers and her impact and ability to reach out to members of her community. But yes, we also would like to see greater representation from individuals in these other groups. Okay, so now let's start the conversation. So looking at the diagnosis journey and how people where people's journeys started. This is really interesting. We had a wide range of responses, but usually people are finding out or getting that diagnosis after just a routine visit to their primary care provider. This may be due to symptoms, but as some of you, personally know yourselves, a lot of times these conditions are asymptomatic or the symptoms themselves are just hard to attribute or say this, I think, is something to do with my liver. And I think this is a very important step, I guess, in the journey to make because, who goes into a doctor's office, it's a routine visit and you're hoping that, well, everything is okay. And then, suddenly your labs come back and maybe your liver enzymes are elevated and then it begins this long and oftentimes confusing, scary journey for a lot of folks. And it seems like that's what's happening within our communities. So I'll pause here for the community to digest, and if this resonates and someone wants to share, does this reflect what your diagnosis experience was like?
I'm just checking the Q&A and chat, Tiffany, but let me just add a comment here. If we look at the first three how your categories of how your journey began. So it's a routine PCP visit, it's an incidental finding, or they presented, and generally it's been with non-specific symptoms. And that's telling us that in the vast majority of cases, because all three of those represents about 60 to 70% of cases, if we have to look at it additively, it's kind of serendipitous. It's kind of by luck, Oh, by the way, I'm not feeling too well. I'm a bit tired, fatigued, non-specific symptoms. And then it was, okay, let's follow that up. And so it tells us that we need to work more on the proactive engagement on the issue, and that comes about with education and awareness. And I think the comment that you posted from one of our patients, I learned that you must be your own advocate. And I think that's really, really important. So from a patient community perspective, how do we empower our patients to be more proactive in their health and actually raise this with their primary care physicians?
Hmm. Yes, wonderful point. Let's keep going. We'll just pause. Okay, I don't see anyone raising their hands. And then looking at what stage people are diagnosed, you can see that this graph kind of has like a U shape. So with people most often being diagnosed either with MASLD or simple fatty liver or late stage 4 MASH. This to me was particularly interesting because it says to me that we're either catching people, early on, which okay, might say that, some early screening interventions are working, but a large number of people are being allowed to sort of silently progress until perhaps then symptoms become so apparent that, you can't ignore it. And then people are being diagnosed at stage 4. So this graph right here stood out to me in particular, and I think that's sort of supported by this comment here that we had from a respondent saying that they wish that the military doctors who first saw their liver back in 2018 would have explored it further. And then they went on to say that they were specifically told it's a non-issue and that millions of Americans have it. Um, this comment isn't unique, and actually, I recognize this theme quite often within respondents. There's this apparent kind of sort of dismissal in fatty liver because it's so common that, it's not really something to worry about. Um, and I don't know, what's your opinion as a doctor, Neeraj? In and you don't want to scare a patient, but it certainly causes a little bit of harm, or it's not helpful to diminish a diagnosis either.
And I don't want to be defensive of doctors, but I think it was also a challenge because back in the day there wasn't any treatment available. So now that we have options and things to offer patients, and not to undermine the importance of lifestyle interventions, diet, exercise, etc. But I think referral or awareness among doctors is equally important to patients. And what we'd love to see is these bars move towards the left. So we move away from MASH towards MASLD. But Tiffany, we have a question from Carlos. Can we unmute him so he can ask his question? Or
Yes.
he has a
I
comment?
will allow you to talk. You should be able to unmute yourself now, Carlos, whenever you're ready. And I will check in the chat, the Q&A.
Oh, go ahead, Carlos.
Let me know if you're having any technical issues. I can see that your mic is unmuted. Let me mute you and then ask you to unmute yourself. There we go. Okay,
Yeah.
Carlos, let us know if we can assist you in being able to speak. You're free to chime in whenever you're ready. Okay, so then moving on to, perception of information and how sort of that was received and passed on from provider to patient, both at the time of diagnosis and then after visiting a specialist. So the diagnosis is on the left-hand side and the specialist graph is on the right. And, we can see pretty consistently um, for each of the 4 years that patients are still feeling like they're not receiving enough information at diagnosis. We understand that, time with physicians is oftentimes very limited. So it I can't imagine how someone could feel that they're, fully prepared after just a 15 or 20-minute visit with their physician. Um, any thoughts there on that, Niraj?
So I think we have to do a better job because at over 50% of not enough information and between 20 and 30% of none or no information, we have to do a better job. So that's close to 70, between 70 and 80% of our patients that's getting none or not enough information. With that said, the retention of information that is given by a doctor to a patient is also in the 20 to 30% range. And when you put yourself in a patient's shoes, so there's a lot of emotion around a new diagnosis. There's anxiety, there's worry, there's concern. People already start thinking, how's this going to affect my life, my relationships, my family, etc. And for them to retain information about their diagnosis and what they need to do and the therapeutic options available becomes even more challenging. And so, what we need to ensure is that patients, in addition to the conversation they have with their doctors, leave with information, leave with web links, leave with a referral to a community of patients, online support, local community organizations where they can follow up with their care, have deeper conversations, longer conversations, and feel a peer level of support to understand their conditions better.
Yeah, so many good points there. And I will just comment on one of them, which is, acknowledging, the anxiety and the fears and how that might oftentimes cloud a person's mental ability to absorb that information. I think it's really important that we give patients tools to show up to these medical visits prepared and feeling confident in their ability to have, a productive, effective communication or conversation with their providers. And that is something that we are thinking about at the foundation. At the Wellness League, we have put together a few different guides for helping you in your conversation with your provider. We do plan to have time at the end of this talk to show you the website. And so I'd love to show you guys where those guides live because they're downloadable and printable. And so you can take them with you when you go to a visit.
Excellent.
All right. Would you like to take this one, Niraj? Looking at the care team, I know this is an item that you enjoy.
Absolutely, absolutely. And so I think in an ideal health situation, the PCP is kind of your quarterback. He's calling the play between the various players on the teams, the running back and um, I don't know all the positions in football, but that's why the PCP is central to the care of the patients and has to be knowledgeable of all the specialists you see and helps coordinate your care. And so appropriately so, the care team is made up of the PCP, and that's generally also been the first port of call when it actually comes to diagnosis. But we're seeing a really nice buildup of a multidisciplinary team. And I had a fascinating conversation with a specialist hepatologist affiliated to a university. And he said, it's important to also realize that your multidisciplinary team doesn't necessarily mean the team meets all together at the same time. It could be staggered and you meet them at different parts. But understanding that there's a multidisciplinary team is important because it's taking care of all your needs related to your diagnosis in a very holistic way. So the psychology, the social aspects of it, the hepatology, the gastrointestinal, etc. And I think increasingly we're seeing the importance and the need for a psychologist or a psychiatrist. And so we need to make sure that the way we coordinate the care and the support that we offer to the PCP from the medical side enables them to perform that function. Have you seen your psychiatrist? Have you seen your dietitian? How are things going? Any gaps in your care? And that's the coordination function of the primary care physician. All that to say, I think we're starting to really get a good sense of all of this, and I'd love to see how this sort of starts increasing in the number of touches that our patients have with their multidisciplinary team. So yeah, I think we're moving in the right direction.
Hmm. Does anyone from the community want to chime in on, their experience here, trying to get referrals, or what is it like? Do you sometimes feel like you're managing your own care team? That's something that I hear a lot, and I read in a lot of the comments um, from the surveys that they feel like they themselves are having to juggle and make sure that information gets passed from one office to the other. Um, and managing the logistics. Meanwhile, they're trying to manage their own health. It can be really overwhelming. or if that resonates, you can raise a hand, show some kind of.
And I'd love to add another question to that, which is of that multidisciplinary team, who's your favorite specialist or part of your team that you love to engage with, that you find most supportive, kind of on a day-to-day basis? We have two raised hands, Tiffany.
Yeah, no, well, that's just to I just wanted us to show each other, that we're not alone in carrying these burdens and uh, having to reach out to different clinics and manage your own care. Um, we
Uh,
see you, and
yeah,
yes,
but Carol and Marcy have questions, I think, or comments.
if that's true, I can go ahead and
Yeah, there we
allow
go.
you all to talk.
Yeah, hi. Can you hear me?
Yes.
Perfect.
Hi, my name is Marcy. I'm located in the Bay Area. Uh, my team, I was transplanted at CPMC in San Francisco on July 12th. Um, and yes, I kind of went into detox and treatment, and I was already um, pretty much stage 4 liver cirrhosis, but uh, I was glad I had a doctor in there where I was at, and she recommended a GI doctor, and she recommended a hepatologist. And then I looked up someone in the Sutter system that had integrative medicine, and she's my primary care. Um, and then my OBGYN, I just scheduled it through Sutter, and she recommended an endocrinologist. So I've been really blessed with the doctors, and my favorite is my GI doctor. She's been with me, from the early on when things were super rough and um, seemed impossible. And she recommended the hepatologist to me. I've just been so blessed with all the doctors in here in the Bay Area, and
Mm,
the team I have is just amazing. And I think it's a team effort. I don't think any one person is perfect. um, Sometimes I double check and go, did you check with the hepatologist? And sometimes they'll tell me, the primary care will be like, float that to the hepatologist. Hepatologists say, float that to primary care. So it's like it's a team effort, and nothing is like perfect, right? But it's pretty awesome. Um, so I'm super blessed. So yeah. Forgot what else, if there was anything else, but thank you.
Thank you for sharing, Marcy. And it's wonderful to hear when the system works. And I think what I also got from your comment is while you have a team, you are also part of the team. And that's all working together in your well-being and your care.
Yes, exactly.
Mhm.
mm. Niraj, I'm kind of curious from your perspective. Well, in order to make a good recommendation, you have to know the specialist. So what is it like? How do providers in one specialty come to know, providers in others? And do you think it's just a lack of, or it's a lack of familiarity? People just don't know who else is in their area.
Absolutely. And Tiffany, I want to comment on that because how that team is configured is really, really important. Before I get to that, let's hear from Carol, and then we have Gabriella as well.
Hi, my name is Carol, and I'm in Michigan, just south of Detroit. And I was F2 to F3 fibrosis, and I was first diagnosed with fatty liver back in 2012. And the GI doctor there said, like you did earlier, oh, it's no big deal, we'll just watch it and see what happens. Well, in 2019, I got a new gastro doctor, and he did the FibroScan, and then that's what kind of like alerted me like, hey, this is something that really needs to be looked at. And everybody else at that time was kind of like dismissing it. And then this is when I was in Florida. We moved back to Michigan. I got another new GI, and was just, well, we'll watch it. We'll watch it. And the more that I did research myself and the more that I learned, I decided to find out and get my own hepatologist through the Henry Ford Health System. And he's been very, very good. I've seen him twice. I've seen him. I'm going back in a few weeks. But none of my doctors work together. It's like the left hand doesn't know what the right hand is doing. And I also see an endocrinologist. I also have Crohn's. So it's kind of hard to navigate through the dietary issues with Crohn's, what you can eat, and then trying to lose weight. And I was taking Wegovy and I lost 35 pounds. Then insurance stopped paying for it, and now my PCP is giving me samples from his office, and I'm still continuing to lose more weight. But other than that, there's been no other type of treatment. And I just wonder what other type of treatment besides that, I believe it's called Rezdiffra, are they offering now for this? And thank you very much.
Absolutely, Carol, and we coming live from the conference in Washington, D.C., and it's been really exciting because in the past year we now have 2 FDA-approved therapies for particularly F2 and F3 fibrosis. So that's been really exciting, and there's also much more engagement of not just hepatologists, but gastroenterologists, endocrinologists, all understanding their complementary roles in patient care. I think certainly discussing these options with a hepatologist, I would say, would be good to see what benefit there is from, in addition to your GLP-1 agonist, to adding Rezdiffra to it. And there are currently clinical trials underway to see the combination of these 2 drugs and the impact that they can have. And also trying to get the nuance of patient characteristics to see which they might be more responsive to. So I think it's a new day in the management of these conditions, and I'm glad that better late than never, you managed to get onto some sort of treatment. You're responding to this with weight loss, and let's see how we can optimize and enhance your management with the new tools available. I know that the company that manufactures Rezdiffra is also has a patient assistance program for those who may not be able to afford it or their health insurance doesn't cover it. So I think that's worth looking at as well. And information is available on their website. Gabriela, you have a raised hand as well.
Yes, good morning. Can you hear me?
Perfect. Yeah.
Nice. Well, I work in Salt Lake City for a community-based organization that is called Alliance Community Services. We are helping mainly Hispanic community. Right now, it's more than Hispanic community. We are getting out in the community underserved, that is under or uninsured. And there are many factors that we are trying to determine here, because we, as an organization, try to tackle down the barriers for social determinants of health and try to improve access to healthcare. As you can imagine, specifically Hispanic community that we see is mainly uninsured, lower income, and they are going through so many hurdles this year. And while we implemented our community screening for fatty liver with FibroScan, as well as blood tests, complete metabolic panel, as well as body composition, we partnered up with other organizations to educate, to navigate patients, and to do some case management. And even hepatologists and transplant surgeons have been chiming in the program. We noticed that many people have been living here in the States for many years, paying their taxes, doing their jobs, studying, raising kids, etc., and have never had a PCP. They came to the program because they were curious to see how they were doing, because they feel that they needed like a general checkup, but it was not offered to them within the community. It's not like they were going to look for it in their organization, in their clinics, because they didn't have any. So my point here is many people will not have a PCP, and if they have this information, which I see it at least from us, what they get, not being since we are not healthcare providers, we are navigating them to diabetes prevention programs that are adequate or culturally adaptive to this community. And also we are doing other actions, because we have found many people that are already cirrhotic and they didn't have any treatment. So it starts from navigating to community partners and specialists, but as you can imagine, it's out of pocket all the time for them, and it's not easy to manage. However, we have had people who already got transplants. We got people who got their treatment for NAFLD, for MASLD and MASH, and it's so hard because it's not just this disease, but the whole metabolic syndrome and the economic, financial, and emotional component of the disease that is tackling down the whole family, because it creates a lot of toxicity, financially speaking and emotionally speaking. So I appreciate all this information that you are providing. It's very reflective of what we're seeing in the community. And I think at this point, as things are, the partnering up in between organizations is the best way to go. And access to clinical trials is also a need for the community. Thank you.
Thank you, Gabriela. And firstly, let me thank you for the work that you are doing at the community level. It's absolutely important. And while we look at a multidisciplinary team of medical and allied medical services, one of the most important things is the context in which people live, which is made up of their social determinants of health, their socioeconomic status,
Can
education,
it stop?
utilities, etc. And so that's really, really important because they have a big influence on health outcomes. So thank you for the work that you're doing. Tiffany is going to walk us through the Wellness League, which is specifically designed to help support as an online community with these broader disciplinary inputs, as well as those social and community-based services. And while it's an online platform, it helps to point people to services at a very local level, right down to their zip code. Tiffany, I want to see how many slides we have so we can sort of go through them very quickly, and then we can go into the Wellness League and have a conversation around that.
Yeah, we've just got about 7 more slides to go.
Okay.
Mhm.
And let me take this because I think this is also really important for our patient community. When people present with liver disease, unless it's very, very advanced, stage 4 and cirrhosis, where the symptoms become a bit more pointed towards what the diagnosis is, then we have a sense of it with presentation. But overall, anywhere from MASLD, MASH to F1, F2, F3, it's very general, non-specific symptoms. So the tiredness and fatigue, the body pain, sleep disturbances, some kind of abdominal bloating, cramping, etc., are the general, very non-specific symptoms that patients have. And so it's important for the patient as well as their primary care provider to have a high index of suspicion that something might be going on with the liver. And I think the key things I want to point out on that is the presence of comorbidities, absolutely important. Type 2 diabetes, obesity, metabolic syndrome, hypertension, high cholesterol, of a particular ethnic group, if family members have had something related to the liver, all of those clues help point these general symptoms that there may be something with the liver. And once again, with the Wellness League and with community-based organizations, we can help point to that and get screening programs to confirm the diagnosis as well. Next slide. Tiffany, this is where we really wanted to home in on, because in addition to all the other features we talk about, the physical features, what we're starting to see more and more are these mental health impacts of chronic disease and the fact that, and related to MASLD MASH and MET ALD. And when we start looking further back on the etiology of this, what is causing this, we find that there's a strong correlation with stigma and discrimination, whether someone is overweight or obese, or it's because of an addiction, like with alcohol or alcohol use disorder. There's the stigma, not just from the community that people might face, but the self-stigma that they face. Is it my fault? Have I done something? I'm scared to talk about it, etc. And all this builds up with features of anxiety, depression, fear, anger, etc., that has mental health impacts. Tiffany, did you want to make a comment on this as well? And let's see if our participants also want to comment on this.
Yeah, no, I'll just say that, putting together the graphs for this part of the survey was particularly uh, it was very concerning. Just when you look at, the frequency and how often, I guess if you've been comparing percentages, and seeing, you'll notice that these bars don't add up to 100, and that is because we allow people to select more than one, because of course you can be experiencing more than one feeling at a time. And so the way to read this is to see that, each year at least half of people who are taking this survey is saying, yes, I'm experiencing feelings of anxiety, as well as depression, and alongside with these other feelings, irritability, fear, anger, and, many more that aren't captured here on the survey. And so then when you compare that then with, the accessibility and how many people are having access to and regularly meeting with, a therapist or a counselor, and you see that's quite low. It's very concerning to see that so many people are just struggling alone. And that feeling of alone too, I think we've got that in the next slide. That isolation is something that patients are also experiencing, and a huge gap that I think needs to be addressed, in the medical setting and outside as well. I think as a society, we need to do better, at recognizing that mental side of illness as well, because yeah, the body holds on to it, and I certainly think it makes it harder to heal.
Absolutely. Tiffany, let's go to the next slide. And please, if our attendees have a question, please raise your hand. Um, so I think, the health becomes the big concern, but there's also all the other loneliness, isolation, money, food, etc. So it's the ongoing life stressors, to which the health stressor and concern and worry exacerbates it, and they feed on each other. And certainly when people aren't healthy, they're not able to go to work, there's more time off work, etc. And that can exacerbate their state of mental well-being. And this is where the role of organizations like Gabriella is so important, because it provides not just the support when it comes to all these services, but it's that sense of solidarity, it's that sense of security that people have, knowing that there's someone out there looking out for them. Let's go to the next slide. Okay, and so this is more part of who people have available to help with their care. Tiffany, do you want to talk through this?
Sure. So yeah, I think this builds off of the past few slides. When people are struggling mentally, who do they have someone available if they needed assistance? And just reading from left to right, the first three colors are someone who are people who have someone available at least sometimes. But you can see that each year about a third of people say that they do not have someone available for help if they needed it. And I think this is a gap that obviously needs to be addressed. The patient is already managing their condition and struggling with the burden of carrying that on their own. There definitely needs to be, a stronger social safety net and resources available for people to reach out for help if they need it. And
Absolutely.
I'll just look through. I don't see anyone raise their hands. I believe this is our last slide, so we could go on into the demo of the Wellness League and show some of those resources. So just here is, high level, just general advice that we want to share with patients in reaching out and managing their condition. First, starting with, seeking professional help. This is not something that you need to carry on your own, and we encourage you to reach out to your providers to see if they can help you get access to mental health professional help. To manage that side of your condition as well. As we mentioned earlier, talk with your doctor. This is easier said than done, but it really does help to be open and honest with your providers about what is going on. I will share that guide that's printable that you might find useful in having these conversations. Connecting with others, this is so important. We are social creatures. We're not meant to walk alone. And so, not not I guess denying the very valid points of, when people are tired and ill, it can be very hard to reach out. But with technology, we have a lot of different options and still getting that feeling of connection with others. I'll highlight some of those programs on the Wellness League as well. We have a number of, peer support programs that can help you sort of build that community and get that connection with others. And then lastly, prioritize self-care. Yes, show yourself self-love all the time. You're always deserving of that self-love, and who better to do that than yourself? So with that, yes, this is just my cue to go on into the Wellness League. So let me do just that. Any last comments, Neeraj?
Um,
Oh, mhm.
I think that was lovely put in a lovely way, Tiffany, and I think the Wellness League has many of these resources that can offer a lot of support to our patient community.
Great. Okay, so with that said, I will hop on over into the Wellness League. Neeraj, can you just confirm that you can see that I've
Yes.
toggled tabs? Okay, great.
Yeah.
So this is the Wellness League. I will go ahead and drop this link into the chat for those of you who are on a computer and maybe want to poke around while I'm speaking. So this is our online platform for patients. It is free to use. There is no sign up. We do have a newsletter that you can sign up to join. We send out emails weekly highlighting different articles on nutrition and exercise. We share recipes and we highlight patient stories. So if you'd like to, you can sign up to the newsletter down here at the bottom. Of the website. And so a great and amazing actually tool of the Wellness League that I love to highlight is our search tool. And this is a user-friendly way to search the hundreds of thousands of free and low-cost programs across the United States addressing these social determinants of health. So helping you find anything from food pantries to rental assistance, job placement programs, peer support, You can see up here, I've called out, 8 different topic areas that I think are particularly important to our community. So, particularly relevant to the conversation today, reaching out and finding someone to talk to. If you click on that tab, we've pulled together a list, and this isn't the full list of national programs across the country, but this is a place to start. And if you read through this list and you don't find something that calls you, or something you think that you would like, you can always just come back to the search tool and type yourself, peer support or talking to someone, and you will you'll receive a full list of programs in your area. So here is a list of programs for peer support. And if you are ready to reach out, all you have to do is click on this green button that's in, let me zoom in because it's quite tiny. Once you read the description on the left-hand side and check, the program hours, some organizations are open 24 hours, some of them, have regular business hours. You can click on next steps, and the search tool makes it really easy to understand what's the next thing to do. For some programs, they still want you to visit their website. For other programs, they might ask you to give them a call. And so the search tool makes it really easy to figure out what that next step is. I can also just do a quick demo to show you what that search might look like. Say we're looking for a food pantry. Oops. Oh, it looks like my mic is not working here. But the other thing I will highlight is this Calendly, this booking section on the right. If you need help navigating this tool, if you feel like you want a little bit extra support, you can actually book a one-on-one session with someone from our team. It's going to be me most likely, and we can sit down and talk about what you need, and we can figure out how to find that through the tool. Another thing that I'll call out in our search tool is its translation abilities. So you can see down here on the right that this page can be translated into over 100 different languages. It's a very long list here. So just clicking on that in a different language will translate the entire page. And so this is a great way, for organizations that reach or work with Spanish-speaking communities. This tool is definitely still usable for your organization. And I guess I'm kind of speaking to you, Gabriella, or any other person who is working with or affiliated with an organization. We are more than happy to share this tool with you all. So if you reach out to me, I'll drop my email in the chat in a few minutes. We can send you the code to embed this tool onto your webpage. So I think that might make it a bit easier for people. They don't have to hop between your webpage and our webpage. You can just embed it in your website and have your community use the tool there. So then I do want to call out those talk with your doctor guides that I mentioned. And so that can be found underneath MASLD and MASH resources. We are working on building out guides for the other conditions, and we will let you all know when that's available. And so for now, we have guides for talking with your providers about MASLD and MASH. And if you click on the icon, you will get access to a downloadable and printable version with 11 questions designed to help you, better understand your diagnosis, reflect on yourself, like things that you're doing, and sort of using that to have a conversation with your doctor on areas where you could improve. Asking questions about clinical trials. This is a great guide, I think, to read before you get to your doctor's appointment, and it can help you decide what is most important for your visit today. It's 11 questions, so you probably won't have a chance to go through all of them, but this can be a good way, I think, for you to decide on a focus, what's really important for you today, and then get those answers.
And Tiffany, it's happened to all of us. We've walked out of a doctor's office and like, oh my God, I forgot to ask this. Oh, I forgot to ask this. And so having this sort of tool, and you can print it and take it with and highlight whichever ones you feel are important, would be very helpful. And we also have resources that can help you answer many of these questions even before you go to the doctor's office, with the diets and the lifestyle, etc., on the Wellness League.
Absolutely.
Yeah.
Yes, we have tons of articles on, different nutrition topics, everything from coffee to olive oil, vitamin E, looking into your liver, understanding non-invasive testing. So we encourage you all to check these out when you have a moment, or sign up for a newsletter to be the first to know when, new information is released.
And I want to add something that Gabriella mentioned, which is participation of patients in clinical trials. And the field is evolving, and we are getting so much better with the science that we do, and the trial methodologies that we run. And I think, if at any point you feel that this is something you want to be involved with, we have resources that would give you more information about clinical trials. There, Tiffany's pulled it up, and finding the trial that's right for you, the various locations, etc. And I think because the medical and research community values patient engagements in clinical trials so much, there is a lot of close hand-holding, support, etc., that you will find from a clinical trial research team. So this is something that we encourage because it certainly moves forward the science and gives us more tools that we can use, to support our patients.
Absolutely. So we are in the last 2 minutes. I will turn it over to the community again. Any last comments or things to share before we hop off?
Oh, Tina has a question. This webinar is being recorded, right, Tiffany?
Yes, it is.
And if someone wants to watch it later, where do they find the link for it?
So we will send a link to the YouTube video later on this afternoon, to everyone who has registered. So be on the lookout for that email there.
Okay.
And also in that email, I will include a link to the full report. We only covered about 7 or 8 questions here. But if you're interested, that full report will be sent to you later on today.
Excellent. Tiffany, you'll put in a link to our YouTube website, right, for the Fatty Liver Foundation. And in addition to this webinar, we have a whole lot of other webinars that we did, with experts from various fields, that present the information in a way that's very accessible to patient communities and general public audiences. So please have a look at that as well.
Yes, I'll drop in my email for any organizations who are interested in getting access to the search tool and giving access to your community. And then I will also add in our YouTube. Let me see. Well, thanks everyone for joining today. It's been a really great conversation. Thank you to everyone who has come forward to share your experiences. It takes a lot of courage to be able to share your experiences in front of an audience. So I want to thank everyone who has come forward, and everyone who took the survey too. your voice matters. We hear you, we're listening, and we're using this to shape our programming. We're using it to advocate, and we look forward to a brighter future for patients.
Tiffany, thank you for